Hello, class. This morning we're going to cover Chapter 13, and Chapter 13 is a very important chapter. I say that all the time, but this one is really important too. The topic of Chapter 13 is professionalism, and just envisioning what a professional is may be different to everybody. So this chapter gives you more or less a standardized viewpoint of the kind of professionalism that you need in healthcare. All right, so let's start by once again defining what is professionalism. So professionalism is an essential quality for everyone who works in healthcare. That being said, caring competence is one way to express the meaning of professionalism in the healthcare environment. Okay? We have to remember, and this is true not only of healthcare, but anywhere that we work, okay, that professionals, once you go to work, you're no longer who you are in your personal life or to your friends. You now flip into the role of representing whatever facility it is you're working for. So example, if you're working for Jackson Memorial Hospital here in Florida, once you enter the doors as an employee, you're now a representative of Jackson Memorial Hospital. And whether you do a good job or a bad job, when people go and complain, they're going to say somebody over at Jackson Memorial Hospital, because that's your identity as an employee. So that's why it's very important for us to be professional, because now we're representing a facility. Okay? Individuals working in healthcare who have positive attitudes and enthusiastic attitudes are thought of as professional. Okay, they think of terms of what they can give rather than what they can get, and patient welfare is the primary focus of these employees. Now, how may you show a professional attitude? Okay, chapter 13 on page 308 starts to list some of the things. So a couple of them would be, number one, be committed to your work. If you don't like what you're doing, you're not serving anybody. And certainly that is going to come through in your actions. So the first thing to do is be committed to your work. All right. The second very important bullet that they highlight here is keep in mind your impact on patient care and services. The patients do respond to professional attitude or someone who walks into the room and terrorizes them. Okay. What are examples of professional behavior on the job? One thing when you come into a healthcare environment that I think is different than most other environments, and all right, yes, many companies today throw around the word team, this team, that team, but healthcare is truly the first and original team environment. Everybody works together. The nurses, the orderlies, the food people, the doctors, the therapists, everybody works together on behalf of each and every patient. So when you go into the healthcare environment, you have to realize that others are depending on you, the information you know, your observations, and likewise, okay? You're depending on maybe, having things dictated and loaded into the computer so you can, let's say if you're in billing and coding, you need those notes to be able to go ahead and bill. So it becomes a team effort. Everybody's waiting on everybody else's information and observation to help that patient and move forward with their jobs, okay? So be dependable. Be dependable means show up every day. Stay there. Don't disappear. Don't take a longer lunch hour than is necessary. Make sure people can come to you and you're there for them. Another one would be to be flexible. In healthcare, a lot of times you just have to maybe cover something else or just, learn to do something else or be there to help someone else, all right? Because just remember, our focus is who? The patient, not us. So page 309 does a really great job of laying out all these different professional behaviors, okay? I would say that a lot of what they say is true on any job that you work in, but it's really important in healthcare because the consequences of what we do or what we don't do is going to affect the patients, okay? So if they have interviewed people. This was a very interesting question on the bottom of, let me see. I kind of lost the question I was referring to. But when people were asked, what's the most important thing to you about doing your job? More than half of them said, doing a good job. That's the most important thing, not just showing up, but I want to be good at what I do. So how do you as an employee do that and, professionally do that, right? We have to make sure that whatever job we're doing in healthcare, we're doing correctly and we're doing it carefully. Can't make mistakes. Some ways that you can develop your skill set, page 310 lists it. So it would be to observe and listen carefully, to consult an employee manual at work. And this is what people have always told me whenever I showed up for a job in healthcare. Ask questions, ask questions, ask questions. That's something else people don't like to do. Why? Because they don't want to appear stupid. They don't want people to turn around and say, what's the matter with you? But really, when somebody is new, the only way you're going to learn, is to ask questions. What I observed as I went along, it was definitely somebody who didn't want to ask any questions. I didn't want to appear stupid, just like I'm telling you. But when I would walk around the environment, and this went on forever, there were two things I picked up that people had no trouble saying. The doctors had no trouble saying, I don't know. And the doctors and other professionals, social workers, therapists, had another thing that they were not afraid to say. And that was, let me go find out for you. All right, let me go find out. I'm not sure. So that's how you learn. You shouldn't be afraid to ask, or get a clarification. Never be afraid of that, okay? Perform all your work as neatly and accurately as possible. There is no room in healthcare for mistakes. There really isn't, okay? And dedicate time to acquiring new knowledge and skills. There are, we talk about in the next chapter, lifelong learning. And so you should commit to knowing that you're going to have to do lifelong learning. There's nothing wrong with it. And it's a way you can improve your skill set and do your job the best you can, all right? Next, we go to professional appearance. Perhaps when I said that this chapter was about professionalism, you thought this is what we were going to talk about. It is part of it. There's many different aspects to professionalism. Your appearance is one of them. And over 35 years, I saw all kinds of appearances change with the trends. Healthcare was a very straight and standardized environment. People always dress professional. For, I'd say up until around the 1990s, then people started getting really casual about how they dressed. And there were some people that took it to levels, you can't wear sandals in a healthcare environment for, bacterial and infection control purposes. So, that was always, you had to dress a certain way to keep in line with the infection control guidelines. But when we talk about professionalism, there's a lot of issues that have come up. And you trust that people know how to dress for work, but I have found that they don't. So starting in, I'd say, 2000, a lot of us started to have to institute dress codes. That is, tell our employees how we wanted them to dress, because clearly showing up at with a white halter top, sitting at the reception desk with no bra is hardly what you want at your reception desk. So in one place, what we did is we paid for a blazer, a blouse, and 2 pairs of pants. And then the employee was responsible to buy whatever else they wanted. But that's how we wanted everybody dressed. And then eventually, my employer of 14,000 employees instituted the blazer, the pants, and blouses for all their employees. And I will say, when you went to the rotunda and there were thousands of people walking around, if you were looking for an employee to ask a question, you knew exactly who to go to. Just find somebody with a black blazer and black pants and you knew that was an employee. So it did pay off. And in different places, subsequently, I had instituted dress codes for different environments, as I said, because we could not rely on the employee. One of the biggest problems I think that employers have had to come across is this tattoo. Because some people have, nice, discreet little tattoos, but you have other people with sleeves and with tattoos that go up their neck to the side of their face. That's unacceptable. Tattoos, for the longest time, really made you think of bikers, or made you, not that there's anything wrong with bikers, but years ago bikers were kind of like rebels, and it did in the movies didn't help with the characterization of them. So most people, especially the elderly, and those are the ones who are in healthcare, who are getting treated more often than anybody else. So when they see this, they think of the rebel people who wear tattoos. And so when they see a tattoo, their reaction is adverse to it. It's not a positive thing that they want to see. So what do we do? There are places that said you must have all your tattoos covered or you can't work here. Another thing, but this falls more into infection control, long fingernails, and even nail polish. Once nail polish is chipped, it becomes an infection control no-no, okay? Because for those of you that don't know this yet, bacteria can go anywhere there's an opening. And cracked and chipping nail polish is one of those places. To have, 3-inch fingernails trying to, handle patients is a no-no. And when you do find yourself in a healthcare environment, just take a look around at the doctors. They're not wearing this color nail polish. They're not wearing nail polish at all. Most nurses don't wear nail polish. All of this is for the reason of infection control. Another professional appearance issue, okay, is long hair, okay? Long hair is wonderful, but if you're in a healthcare environment and you're working with patients, it should be neat and it should be pulled back. And so when you lean over the bed, it's not going to drape on the patient. We do know that there are issues with even doctors' ties leaning over the bed and touching the patient. They became aware that the doctor's necktie is probably one of the biggest transporters of bacteria. So doctors they wear lab coats, but now they're being told to button them up to here so that tie stays inside and they don't lean over and have the tie. Or you'll see some of the doctors actually flip the tie over their shoulder so it doesn't go anywhere near the patient. Well, the same thing with hair, okay? You may laugh at the next issue, but I can tell you we have, and this has been going on forever. When I used to work in a research lab, we had a lot of foreigners, people who came from different countries, and their hygiene was not exactly the same as ours. And you would get on the elevator and you really wanted to turn around and address the group by saying, people, this is deodorant. And we had another case in one of my offices where one of the nurses had such bad body odor. She was overweight, and I'm sure that had a lot to do with it. But nobody wanted to go in her office. No one really wanted to talk to her. They were doing social distancing with her a million years ago. And nobody wanted to tell her. And so that became an issue. So you may think, yeah, everybody knows to shower every day and to use deodorant, but guess what? That's not the case. Whether it's for, cultural issues or, maybe health issues, you may come across situations where people, really have, these issues. And so good hygiene is something else that's really, really important. When you're in a healthcare environment where you're dealing with patients, another issue is perfume. Number one, you have patients that are allergic, patients that just find it offensive. So another best practice is not to wear any perfume. And I know that a lot of people like to do it, but sometimes you'll actually have the patient say, I'm allergic, please, leave the room. So that's something else, things you wouldn't think about. The next issue would be professional distancing. Okay, now what we mean is professional distancing from an emotional standpoint. Okay, it's okay to be friendly. We encourage friendliness with patients, okay? But we need to remain in the mindset that it's a professional relationship. It's not a personal relationship. So we have to work to please the patient rather than serve appropriately. Can be counterproductive. All right. So the goal in healthcare is not for us to become a friend of the patient. The goal in healthcare is to maintain professionalism and serve the patient in a friendly manner. Okay. Another professional distance emotionally is not to get too involved with the patient and what's going on. For the simple reason, if you become overwhelmed with emotions or grief over a patient, you're not going to be able to serve the patient. It's not good for you either, because in healthcare, believe me, you see everything. You see the most horrendous stories and the most tragic outcomes sometimes. And so you need to be able to work through that and to help the patient or the patient's family or whoever, is involved in this scenario. Don't forget, your stance is you're a professional. Okay, so that's something that we have to warn people, because well-meaning, kind people tend to want to do everything. But the thing is, that's only one patient. If you do this for every patient, you have 70 patients coming in a day, that's 400 patients a week. You are not going to be able to physically or emotionally sustain this kind of effort. Okay, so that some people learn it after years, other people, learn or go into it because we teach it. All right. Another and more difficult aspect of being a professional is to take criticism, okay? We all get criticized. Everybody does, because none of us are perfect, all right? Even the ones we look to and think are perfect aren't perfect. So it's not so surprising that from time to time there may be a criticism. And the criticism may simply be because the person you're working for wants something done, or the person you're working for needs everything to be perfect for their own reputation. And so they're instilling in you or criticizing you because they're afraid it's going to reflect on them. And in a real sense, it does. Okay? So when we are criticized, all right, we have to use it as an opportunity to improve whatever it is we're doing. And there's no harm when you are criticized to say, can you explain to me, exactly what it is that you're not happy with, number one. And then number two, you can ask them, can you tell me how I can improve what I just did, or the reason we're having this discussion. Okay? So this is a very short chapter, and there's only a couple of more little issues in it. And not issues, but, segments of it. So the next one would be professional organizations. If you really want to do good job, and you really want to be professional, you should belong to an organization, a professional organization. Because in these organizations, what they do is they sponsor continuing education, which is lifelong learning, which is a way to keep your skills up to date. You'll get any kind of news about the profession. They promote the profession. They usually sponsor meetings, and they encourage networking. If you're looking for a job and you have made contacts in an organization, you can always contact them and say, guess what, I'm looking for a job. I'm looking for a job in Missouri. You have anybody, or anybody over there. So these professional organizations, most of them have annual dues. Some jobs that you may have will pay for your annual dues. Some of your jobs will even sponsor you going to these annual meetings, or if the meeting is really relative to the work that you're doing, they'll pay for it. So, and that's what's good about working for these really big places, because they have much bigger budgets, and they're more likely to support you going to conferences and belonging to these meetings, memberships, okay? And then lastly, we look to our leaders to be professional. It's very disappointing when the leaders that we have around us are anything but professional. And very often, people sometimes believe once they get to a higher level that none of these rules apply to them, and they start behaving how they want to behave. But boy, is it a gift when you have a leader who is professional. And some of the characteristics of these leaders would be a high level of competence, all right? They know what they're doing. They, are somebody who can guide us to success. All right, commitment to providing high quality service. All right, they're committed to it. A willingness to recognize and support the work of others. They don't want to always take the credit for things. One time I had written up something for a meeting, and my boss tried to pass it off. And when I showed up at the meeting, the head of the meeting came to me and said, Donna, who wrote this? She didn't write this. You wrote it, didn't you? And yes, I did. And someone tried to pass it off as their work. I mean, I wasn't going to say anything because, it puts you in a really horrible position. But someone else knew that, okay? And that's just an example of something else. Dedication to meeting high standards. This whole issue of change. Boy, I was in healthcare from 1983, and you want to talk about change. Every single aspect of healthcare has changed. And it continues to change, and it's not there yet. However, you will never understand and never believe the behavior of people who don't want change. I've had almost an entire staff get up and resign and leave because they didn't want the change when we brought in the computers into the office. That was it. That was more than they could take. They'd been doing this job for like 30 years, using a typewriter and writing it down. And then we said, okay, here's a computer. And look, the keyboard is the same. Nope, that was it. They all left. They all retired, saying, no, we're not going to do this. So whenever you have to bring in change, a good leader knows how to acclimate is the word I want to say, have the staffing prepared and ready for whatever change it is. And I think most people are afraid of change because it's something they have to learn, something they have to be trained for. And once again, people don't want to be stupid. So, you're used to doing something for 30 years, you do it perfectly. Something new comes in, and what they're really reacting to is the fear of change because they don't know beyond the change what's out there. That's all unknown. So that's what people react to. But as I said, healthcare has been a field that every single aspect has changed for the doctors, for the nurses, for the staff, for everybody. And even though they're doctors trained in saving human lives, their reaction to change was exactly the same as the clerk. So that was always very interesting to me. And their behavior, it is because we're all human. It doesn't matter what your degree. It doesn't matter, what you do for a living. Basically, underneath it all, we're humans with human anxieties and fears of something as simple as change. Okay? Once again, professional leaders know how to communicate. They don't stand there and say, we're doing it because I said so, or those jerks down in, administration want us to do it. That's not how you communicate. You communicate by handing out support documentation, by preparing way ahead of time for the change, and being able to effectively address all of the concerns and issues and support, frankly, for the change or for whatever the issue is. Sometimes you have horrendous things happen in healthcare. Someone has to be able to communicate what happened here, okay? And you need a professional leader will know how to do this, all right? And like I said, once again, what a gift to work under somebody who's really professional and has all these characteristics. So that is the end of this chapter. As I said, professionalism seems, like it's just a little, word, but it really is. It's really critically important. So when you read it, you should be asking yourself, do I exhibit this? How can I exhibit it? And then think about all the people that's around you and see if they're exhibiting it. And then see how you can up your game to be more professional. Okay, so that'll be it on chapter 13, and I will see you during the next chapter. Bye-bye.